Sex. Do you talk about it enough with your clients? My name's Kelly. I am a CBT therapist and forensic psychologist. And this is something that often comes up with the people that I supervise. That when you are doing an assessment and when you're talking about someone's mental health or their mental well-being, that there isn't enough questions about sex. So why this is important is because when we are engaging in sex, whether that is with other people or with ourselves, that people think that it just happens within our bodies. But actually how we're thinking, what we're feeling, can often be happening in our brain, obviously, and that can maintain or increase or decrease arousal. And when people are experiencing anxiety, low mood, or any other mental health difficulties, often sex is at the back of the list. They may be ruminating about certain situations. They could be overthinking about the actual intimacy aspect of it. And all of this can impact upon someone's engagement in sexual activity, but also their enjoyment in it. And why sexual health is so important is because that there are so many benefits, whether it is with other people or with that intimacy, whereas it's about looking at your own self-esteem. And it can even looking at the feel-good hormones that sexual intimacy actually can release. I'm talking about endorphins and oxytocin. And this can have an impact upon your own mental well-being. But sometimes it isn't spoken about enough, whether this is from the therapist asking the questions or the client feeling comfortable to say it. So it's about bringing that into the room, talking about it openly, because it's so important. If we don't talk about it, then we don't know the impact that it could be having on someone. It could be the elephant in the room that they may be a little bit unsure about how to bring up. But us as therapists can bring it in. We can make it not taboo. We can normalise talking about it, normalise talking about the difficulties, talking about the fact that you just don't want to do it when you are feeling really anxious and you put your own pleasure or pleasure with other person right at the back of the list. So this is just a video just to say, talk about it, ask about their sex life, ask about, is it something that they enjoy, is it something that they avoid, is it something that they have enjoyed previously that they've noticed a decline in, is it something that they used to maybe pleasure themselves quite a lot, but since they've been feeling a little bit different to how they were before, that's not something that they do anymore. So being able to normalise it, talk about it, put it on the table, so then clients, if they want to talk about it, they will. But if we don't bring it up, how are we going to expect the individuals that we're working with to feel comfortable to bring it up as well? I hope that helps, and as always, please like and subscribe, and thank you for watching.